Hello everyone, a very warm welcome to the Smart RN channel. Thank you for logging in. My name is Henry. In our video today, we are going to look at asthma management. In our previous video, we looked at asthma and we said that asthma is a chronic condition that causes the narrowing and swelling of our airways. And this condition normally makes it difficult for air to be moved in and out of the lung. So if you have not watched that video, please go and watch it so that you can be able to understand what this condition is all about. Now, asthma can be managed in a number of ways. We have got a number of ways which we can use to manage asthma. One is by the use of medications. There are medications to manage this condition. One of the medications are rescue medications. Rescue medications are those ones which are used once an asthma attack has occurred. These are medications that we use when we are actively having an asthma attack. These medications are short-acting beta-2 adrenergic agonists, or the SABAs. Now, these medications are normally short-acting bronchodilators. Now remember this, when you have an active asthma attack, your airways are constricted and narrowed. You are having difficulty moving air in and out of the lung. Now, the priority now is to dilate those airways so that we can move in air into our lung. And this work of doing that bronchodilation is by use of the rescue medication. The gold standard medication used for this purpose is albuterol. Albuterol is a short-acting beta-2 adrenergic agonist. It acts very fast to dilate our bronchial or to dilate our airways so that we can move air in and out of our lung. A very good example of albuterol medications are Ventolin and Proventil. Remember, these are rescue medications only used when you have an asthma attack. These medications are used for asthma exacerbations only. We use them when an asthma attack has occurred only. We do not use them regularly. They are not for regular use, only used when you have an asthma attack. Now, what will happen is that if you use this medication, or if you use these rescue medications regularly, there are a number of things that are going to happen. One, you are going to experience more frequent asthma exacerbations. So regular use of rescue medications will expose you to more frequent asthma exacerbations. Number two, you are going to experience more tolerance to this medication. In other words, these medications are going to have less effect on you. The more you use them, the lesser the effect. So that means that if you keep on using these medications now and again, a time is coming when they'll not work for you, and that's very, very dangerous. So that's why we only use them when we have an asthma attack as rescue medication. Number three, if you use these medications frequently, you are going to experience what we call a decreased baseline pulmonary function. Your pulmonary function is going to be dependent on those medications. In other words, you become like you're dependent on them. So you are going to lose your baseline pulmonary function if you use these medications on a regular basis. And lastly, you are going to increase hyper-responsiveness. A very small thing is going to trigger an asthma attack all the time because you are used to this particular medication. So one thing you must remember is that rescue medications are only used when you have an asthma exacerbation, when you have an asthma attack, and they are used for short term only. They are short-term medication. You don't use them long-term. We use them for a short time only. Once our airways have now been dilated and we can now breathe, we stop using this medication. Another thing you have to realize that the use of rescue medications is not stopped abruptly, but they are tapered off. You taper the use. For example, if you're using, let's say, you use like maybe 5 puffs, you come back to 4 puffs, 3 puffs, 2 puffs, 1 puff, until you decrease the use of that particular medication. So these medications are not stopped abruptly. You taper them off. Now, apart from rescue medications, we also have long-acting control medications. Long-acting control medications are those medications that you use daily to manage your asthma condition. Unlike rescue medications, the long-acting control medications are used on a daily basis regardless of the symptoms at any given time. And there are a number of medications in this class. One, we have got anti-inflammatories. Anti-inflammatories are those medications that decrease the production of mucus. Remember, if you look at the previous video, we said that mucus production is very high. When we have an asthma attack, our goblet cells produce very thick mucus that block our airways. So these anti-inflammatory medications normally decrease mucus, thereby allowing our airways to remain open. And a very good example are those inhaled corticosteroids. Those inhaled steroids that you inhale, they are very good examples of anti-inflammatory medication. And then we also have bronchodilators. In this long-acting control medication, we also have got bronchodilators. These are medications that help your smooth muscles to relax. Remember, we said that our airways have got smooth muscles. When these smooth muscles are tightened during an asthma attack, they constrict our airways. So bronchodilators are those medications that we use long-term to help relax our smooth muscles and therefore make sure that our airways remain open. And a very good class of these medications are salmeterol and formoterol. Formoterol and salmeterol are very good examples of long-acting bronchodilators that we use for daily management of our asthma condition. Please remember not to confuse between these medications and rescue medications. Rescue medications only used when you have an asthma attack, but long-acting control medications, they are used daily regardless of the asthma symptoms. So we have got anti-inflammatories like inhaled corticosteroids, we have got bronchodilators, especially salmeterol and formoterol, which are long-acting smooth muscle relaxers. We also have anticholinergics. Anticholinergics are a form of bronchodilators. These are medications that are referred to as muscarinic receptor antagonists. These medications normally block the parasympathetic nerve reflexes, which result in airway constriction. In other words, they block acetylcholine-mediated bronchospasm. They inhibit acetylcholine-mediated bronchospasm. So they work by inhibiting that neurotransmitter referred to as acetylcholine. So they are muscarinic receptor antagonists, which result in our airways remaining dilated so that air can move in and out of our lung. And very good examples are ipratropium and also tiotropium. These are anticholinergic, which are a form of bronchodilator. So these long-acting control medications are used on a daily basis. Anti-inflammatories, bronchodilators, and also anticholinergic medications. Another very important thing in asthma management is an asthma action plan. Every asthma patient must have an individualized written asthma action plan. You approach your healthcare provider, and your healthcare provider will help you develop an asthma action plan. Now, this action plan normally helps in the daily management of asthma, and also it helps to recognize symptoms and exacerbations. It helps the patient to recognize symptoms and exacerbation. So it is very important that every asthma patient has an action plan. What did you do when you have that particular condition? Now, the asthma action plan has got 3 zones. One, we have got a green zone, a yellow zone, and a red zone. There are 3 zones in the action plan, and all these zones will always tell the patient what to do at any given time. So let us look at this action plan in detail. So as we have said that the asthma action plan has got 3 zones. the green zone, the yellow zone, and the red zone. Now, the green zone is when you are doing well. When you are in a green zone, it means you are doing well. One, you do not have those asthma symptoms. There is no cough, there is no wheezing, there is no chest tightness, there is no shortness of breath, and the patient, or as a patient, you are doing your usual activities. Your life is normal. You do not have any of those particular symptoms that are associated with asthma. Another thing is that, remember, we talked about a peak flow meter. When you look at your peak flow meter readings, there are more than 80% of your best peak flow. There are 80% or more of your best peak flow meter reading. Remember, as an asthma patient, we say that you must have peak flow meter reading. So when you have your peak flow meter reading, and during the green zone, you find that your peak flow meter reading at that time is 80% or more of your normal peak flow meter reading. So in the green zone, it is going to specify what is your best peak flow meter reading, and your peak flow meter reading at this time, we say it must be more than 80% or more your best peak flow meter reading. So in this green zone, the patient is doing very well. The asthma symptoms are absent and the peak flow meter reading are good. So what you do this, the action plan will always identify the actions that you must take when in the green zone. When in the green zone, take your long-term control medications each day. Remember, we said that long-term control medications are those ones that we use daily, irrespective of our asthma condition or symptom. We use them on a daily basis. So in the green zone, you are taking your long-term control medication. So the plan will specify, take medication number 1, take this medication, take this dose at this time or this number of times per day. Take this medication, take this dose, this time of day. So it is going to specify the medications, the doses, and the times you are taking every day. And remember, these medications must include an anti-inflammatory. Those medications that prevent the production of mucus, especially inhaled corticosteroid. So this green zone is specifying the medications that you take on a daily basis. You are doing well, no asthma symptom. You are doing your daily activity. At the bottom of this green zone also, it is going to specify the medication that you take before exercise. Remember, we can have exercise-induced asthma. You could just be well. Then when you go and do exercise, then there you have an attack. So we have got exercise-induced asthma. In the green zone, it specifies the medication that you're going to take before you can go for exercise. For example, to say, take this medication, either 2 puffs or 4 puffs 5 minutes before exercise. It always say 5 minutes before exercise, take these 2 puffs or take 4 puffs or whatever particular medication. This is according to your doctor. So what your doctor prescribed before exercise is also going to be put at the bottom of that green zone. So in the green zone, just like the traffic lights, everything is doing well, you are ready to go and all that. Then we have the yellow zone. In the yellow zone, the symptoms are getting worse. When a patient is in the yellow zone, the symptoms are getting worse. Now, in this yellow zone, the patient is having a cough, is having wheezing, is having chest tightness, experiencing shortness of breath. He's waking up at night due to asthma symptoms, and also they can only do some but not all of the activities. So when you find that you have these particular symptoms, then you are in the yellow zone. Your plan will say what to do. Number 1, your plan will say that add a quick relief medications to your long-term control medication. Now, on top of this medication that you are taking in the green zone, when you come here, step number 1, you are asked to add a short-acting beta-adrenergic agonist. This is albuterol. So it says add either 2 puffs or 4 puffs every 20 minutes to 1 hour. So you add this number of puffs which have been specified. Now, when you add this medication to your long-term control medication, If the symptoms improve after 1 hour, continue taking the green zone medication. So if the symptoms improve, when you add this and your symptoms improve, then you are back in the green zone. Then you can keep on taking your control medications as specified. But if your symptoms do not improve after 1 hour and you are still in the yellow zone, then the plan says add a short-acting beta-adrenergic agonist and an oral steroid. So if these symptoms are not getting better after adding this albuterol, so here you're going to add a short adrenergic beta agonist. It will specify the number of puffs, and then it also specifies whether you should use a nebulizer. You can even use a nebulizer or a machine treatment at this particular time. And then you add an oral steroid. It specifies the number of milligrams per day and for a number of days. Then, if the symptoms still do not improve, you are asked to call the doctor before or after a certain number of hours after taking the steroid. So remember, in step number 3, the symptoms do not get better with only a short-acting beta-adrenergic agonist. So on top of this short-acting beta-adrenergic agonist, you also take an oral steroid. And you are told, call the doctor before taking that oral steroid or within a number of hours after taking that particular steroid. So your plan is going to specify. So here, remember, all these medications are being taken together with your long-term control medication. And then we have got the red zone. The red zone is a medical alert. This is where the patient is now very short of breath. The patient has used quick relief medications without any help. You have been using albuterol, but there's no help. Your conditions or your symptoms continue getting worse despite the use of this quick relief medication. The symptoms are worse, or the symptoms are the same, or they are worse after you have been in this particular yellow zone for 24 hours. So you have been in the yellow zone for 24 hours and the condition has not improved, or the condition is getting worse. The quick relief medication that you have been using here, they are not helping at all. And also, when you look at peak flow meter reading, it is less than 50% of your base. This is serious. This is a medical emergency. So it says, your plan will say, take a short-acting beta-adrenergic agonist. We still need it to help to dilate our airways. Also, take a short-acting beta-agonist, either this number of puffs, 2 or 4 puffs, or use a nebulizer. This is a treatment machine. Then take an oral steroid, it specifies the number of milligrams, and then down there says, call the doctor now. Call the doctor now. Why? Because your symptoms are not getting better. You are using quick relief medication, you're using oral steroids, but your symptoms are not getting better at all. So call the doctor now. Or it says call an ambulance and go to the hospital after 15 minutes if you have not reached the doctor. So here you're going to call the doctor. But if 15 minutes and you have not reached the doctor, go to the hospital if you can, or call an ambulance. Why? Because these are the medical emergencies. These medications are not helping and your condition needs management at the hospital. So these are the 3 levels of your asthma action plan. Every day, an asthma patient must identify in which zone he or she is at any given time and take those actions which have been explained in each and every section depending on the zone in which you are. Remember, with the red zone, that's a medical emergency. You are taking the short-acting beta agonist and the oral steroid, but you are also calling the doctor right away. If you don't get the doctor within 15 minutes, please go to the hospital or call an ambulance. That's what your plan is going to say. And this is what we refer to as an asthma action plan. So it's a very important plan which every asthma patient requires to help in the management of this asthma condition. So that brings us to the end of this video on asthma management. As always, I ask you to drop a comment. I ask you to share this video, to like this video. And if you are not a subscriber, kindly subscribe to this channel so that we can be able to grow together. From me here today, it is a goodbye.